So hi guys, so welcome to my channel. My name is Belo and I am the founder of Delay MNL Candles, and I'm lighting this candle right now so I can have a more extra relaxing vlog today because this is a long overdue vlog. Guys, I'm sorry if I'm like unfocused on the screen, but I'm trying to be as spontaneous as I can be. Oh my gosh, I gained so much a little weight right now. I'm trying to lose some weight. Don't judge me because I'm trying to get myself. Anyway, this has been a long overdue vlog, and I'm gonna be honest guys that one of the reasons why I decided to pursue and continue this vlog is I was looking at my YouTube analytics and I saw that one of the things that you guys are interested in searching in my channel is my rhinoplasty journey, and I decided that maybe I can give more a thorough sit down breakdown of my journey of my rhinoplasty. And so, without further ado, let's get started. I have a list of everything I think that I compiled in the past, and I even have like my previous receipt, I think, of my consultation. And I'm just gonna go into the flow. This will be a little bit random. Yeah, anyway. Let me start when I had it. I had my nose done somewhere 2017, May 10 to be exact. It's here on my phone. I've been almost 6-7 years post-op now. And if I'm gonna ask myself a question, or you guys are gonna ask me a question, am I happy with my nose job? I think from a scale of 100 being the highest, I would say probably maybe 90%. Yes, 90%. Almost to 100, the days and the times that it's almost 100, yes. The other 10% is because social media messes up my perception of how I look like and being satisfied with who I am, or just always not wanting to settle with already what I have despite having all the compliments in the past. So probably just the 10% that does not take my day or does not ruin my day, why I'm kind of like happy with the result of my nose vlog. And I'm also gonna tell you and break down into detail why I'm pretty happy. Now, let me start and begin with a question of why I had a nose job. I had my nose done somewhere 2017, and I think I was 24 years old at that time when I decided and I turned the idea that I'm gonna get a nose job just because before I turned 25, before I reached like a milestone in my life, that I wanted some change or some drastic change in my life at that time. And I've been wanting to really get a nose job at that time. But I guess it was something a little bit of my insecurity too when I was younger, and I was just entertaining the idea. Then I started doing a lot of research, and before I took things seriously, then that's how I came into the rabbit hole of getting it done. And by the way, so I'm trying to give you guys the close-up. This is the close-up of my nose. There. Yeah. And more or less, I had it done in the Philippines. I had it done in Manila, to be specific, and I was a flight attendant back then when I had it done, so it was just more easier for me to like travel back and forth when I did my nose job. But I had to like a lot of time and really fit everything into my schedule before anything else. Now let's talk about the price. This is very important because I know a lot of you guys will be asking this in your whole research process. When I had my consultation at the Belo Medical Group, where I also pursued my surgery and I also did a commercial. So I did a consultation somewhere January 13 of 2017, and I had like a full breakdown of how much it cost for me to get my nose job, and it's 119,842 Philippine peso at that time. But roughly January, February, March, April, May. So roughly, I think after that, I spent a little more than that. I think 125 to be exact. Only more or less that, including all the things that I needed to recover, the medications that I needed, and all the cleaning materials that I need to clean my wound at that time. And let me give you a little bit of a breakdown of what they had on this, the procedure that they had to perform on me. They needed to do an augmentation of the radix, and as per patient, they also needed to do some septoplasty, ear harvest cartilage. It says here that I'm pro osteotomy inside, and this is the osteotomy, I guess. This is the width, so to make it more slimmer. And Ayleplasty, they had to like trim my alar. And it says here that smile correction, but I felt like they didn't push through the smile correction. I didn't felt anything when it comes to the smile correction. And now let's get into a different part, which is the research phase. I think for all of you who are watching this vlog right now, is research phase is something that I'm not ever going to compromise. And for those of you who are in that phase as well, is for you guys to like consider the length of time. Lalo na dahil this is a surgery, major surgery though. This is a major surgery, guys. And I'm really urging all of you guys to like get it done once, right? At least because in my experience, I know the struggle that I've been through, and I know the mental challenge and struggle that I don't want to go through anymore, I think. And it's actually one of the reasons, going back to why I'm happy to the 90% of most of the time when I look in the mirror or look in the camera about my nose, is that recovery wasn't something that is very pleasurable or something that I enjoyed, that it was just not easy for me to ignore. And some other people do recover differently. Each patient and each person and individual are different, and each on his own. And in my own experience, that is what I had to go through. Number one in your research phase is your plastic surgeon. And it took me at least 5 to 4 different plastic surgeons, from just searching and everything online, and what kind of surgeon are they? Are they an ENT surgeon? And I also needed to like look into their safety track record, and going into the consultation more, if you can ask for like a portfolio of a before and after of their some patients. And so it's very important for me to like really gauge and determine when and how like ito na ba talaga yung gusto kong maging surgeon. So for those of you, by the way, guys, who are watching, I am Filipino, and I'm speaking in Taglish para sa mga foreign audience that I have, and also para sa mga Pilipino na audience ko nanonood. So hi. And after getting all of that details of choosing your plastic surgeon, is now like I think I was looking now into finding a reference of my ideal nose at that time, and I'm trying to like go back as fast as I can with my ideal nose. It's also best to get to have a conversation with your surgeon, because the consultation phase, where it's the part where I think a good surgeon has to like set your expectation. It's like, because I know a lot of some that I found myself enjoying myself in some groups on Facebook, where they have this so unrealistic expectation of how they want to look like. It's like almost copy and paste of a celebrity or a model that they saw online, or a person that they saw on social media or online. And it's just not realistic in my opinion, because your face is still your own. And yes, there are more resemblance, there are more faces out there that have more resemblance to some faces, but there are just faces out there where it's just a little far off. And I think that also is some struggle for a lot of people, that they're expecting their reference or their basis of their photo that they are showing their surgeon, that that's how exactly they're gonna look like. And I want you guys to like get rid of that expectation, okay? You need to find like a surgeon who's gonna approach the aesthetic of your face that's still harmonious to the balance and to the symmetry of your face. And now, after getting into that referencing and like your ideal nose, I think it's very much important as well to know the material that you're going to use, especially if you're going to get your bridge augmented like I did. And when I was doing my consultation, I was also from different surgeons. I went to Korea, and then the rest I went to the Philippines. And in Korea, from all of the surgeon and plastic surgery clinic that I did my inquiry, a lot of them, a majority of them were not comfortable at using Goretex as an implant. Majority of them were using silicone or rib cartilage, but I wasn't pretty much keen to getting rib cartilage just because I got scared with it back when I read articles on the possibility of cartilage collapsing. So I kind of like disregarded that with the options. And I had like a good amount of research from different surgeons as well, especially my preferred surgeon about Goretex, how it's so porous, that it has pores, that tissues can grow into the pores of the material, and how eventually it becomes like a part of your body. Although, I mean, it doesn't mean that there's no risk of rejection. Even silicone and even cartilage have a risk of some abnormality that happens, and I think a good surgeon will set that expectation for you. I did not pursue with the cartilage harvest for a lot of reasons, just because I don't know, I was just scared that I don't want to go back through the whole process for only my nose to collapse, you know? Okay. Silicone, I think I got scared with the thought of silicone just because I've seen a few of colleagues of mine too who had silicone implants, and I just didn't like it because it didn't look natural, and it's very like protruded. It's so defined too, which kind of like, it was just not something that I want for myself aesthetically. And scars, like this is such a big important topic for me, because I think one of the anxieties that I was getting myself into during the research phase was all of the variables that I was looking at is the scar, especially for Ayleroplasty. And I think I had a pretty big alar at that time. I wasn't really much like happy with my alar, but at the same time, I didn't really want to like a drastic looking like I'm a Caucasian person just because of my alar. I just want some more cuter, more finer. And I saw a few friends of mine who went to, I didn't finish, okay, sorry guys, medyo I am jumping into one topic to the other. Hindi ko natapos yung surgeon phase ko. So yes, after I went to Korea, I was talking to, so majority of the surgeons that I did a consultation, especially sa Pilipinas, majority of them are very much comfortable with Goretex, and a lot of them are giving me reassurance about the longevity of Goretex. So I kind of like relieved that stress in my head. I just wanted to like, I know that there are some patients out there who had like silicone on their nose bridge, and I'm not sure where the data is, how successful or how the retention or the compatibility, the rejection rate of their noses after maybe 10 or 15 years. And I've had like mine for how many years now. And mind you guys, my nose has gone through some trauma. There was a time I was in Qatar, I was a coffee bean, I was rushing and going to the second floor. I didn't realize that there was this door out there that's clear glass. And so si aligaga, I wasn't paying so much with my surrounding. I was just walking through it, and then voila, with force and with speed, I hit my face on the glass. I bled a little bit. The moment it happened, like I had to like text and email my surgeon at that time. So thank God nothing happened. And I remember, but this was already, I think I was probably a year post-op already. And thank God my surgeon told me that because it's been almost a year now, that my nose has had its chance to settle and be fixed. So I didn't have like a big deformity. And so prior to that, like 3 months after my surgery, I remember I was operating a flight and I was opening an overhead bin in the galley, and there were stacks of unfolded boxes. And so trays, that's what they call it, trays, collecting trays. And I opened it from a 787 aircraft, and tack, 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 like there were like 3 stacks of boxes, unfolded boxes, like fell in the middle of my 3 months post-op nose. And I lost it because there was this girl, actually I forgot. I think I wasn't the one who opened it. It was my colleague at that time, and she wasn't very tedious enough to like block it before anything else. And so everything fell in my face at that time. But I mean, I'm just glad that I didn't have to go through that major problem, and so I'm not wishing to. So even my surgeon said, no matter whether your nose is real or not, if there is an excessive traumatic force that will hit your nose, it will break. So natural or no natural, you have to take care of your nose. Okay, I think I did not finish about the scars. So let me give you a little bit of a close-up since, anyway, I'm doing the vlog right now, guys, and since I can't deny. I was very obsessed with scars, and every consultation that I had with different surgeons, it's something that I always emphasize all the time, and I didn't want to compromise. And upon doing my research, there were some surgeons out there who will give you a total 360 transformation, but because there are limitations into what the face and skin can do, some patients do experience severe scarring, and it was such a big no-no for me, despite the good result and in a good form. And this is why I settled with a more conservative approach, and I'm pretty happy about it. And even in a close-up, people won't notice that I had my nose in because the scar is just so seamless, and that's why I'm so thankful. So I'm pretty happy with the scars. So I don't have scars much, but you can see this is the incision. That's the incision there. They cut my alar like only up to here. And I have a incision here. And so there are days and there are times that I find my alar still too wide, but I don't know, I kind of, when I look in the mirror, and like right now, I'll just give you a reference. Let's say, let me shrink my alar a little bit and how I would look like. Yes, I would look like this. And I don't know, I think for how many years, it's been 7 years now that I've settled with this type of face structure, and I felt like I'm now more truer to my identity. Especially, I know that there's a lot of people out there who have to like undergo different revisions, and it's not something that I wanted to go through anymore, just because I know the fact that even when after my surgery, my surgeon setting my expectation that there can be a chance that I might not like it. And also I have to entertain the fact that it hasn't reached its full form yet, because I'm still in the recovery phase of letting the swelling to subside. And I think that hindered so much on how I see and how I view myself, because I couldn't get past the fact that I'm still so swollen. My nose has in the times of my recovery and my recovery period of after 7 days to more like 6 months. I think it was really 3 to 6 months that I really started appreciating the form and the result of my nose job. And then when I started getting more compliments from different passengers and colleagues, and that was the day like, oh my gosh, I woke up like this moment. Gandang-ganda sa sarili. Ganung moment. So for those of you who are not Filipino and you don't know what's GGSS, gandang-ganda sa sarili, you can Google that. Okay, things that you needed to consider. Risk. I think there's no surgery that is, I think, in my own opinion, just giving you guys my experience, that is risk-free. And I think one of the reasons why you need to find a good plastic surgeon who prioritizes a safety track record, not just another cash grab out there who's just gonna take your money and be done with it. Of course, there's so many surgeons out there, especially now, 2023, that there's so many experienced surgeons out there that will just take your money for the heck of it, and you don't want that. Okay, so you have to like ask them as well, like how many patients do they do surgery in a day, because that will determine whether, my gosh, pang third ka na pala tapos pagod na siya, hindi niya na alam yung ginagawa niya. Okay, wala, ayan na. Okay, now let me talk about the hardest part of the surgery. Like again, I think I've mentioned it already, the hardest part for me was probably recovery because the swelling and everything. It wasn't, when it comes to, let me talk about the pain, it wasn't painful. It was just uncomfortable at the first 2 weeks, especially where they harvested the cartilage, which is the ear area. And I think my ear was the part where it really took the longest time to heal. I don't know, I guess because there's not a lot of blood vessel running into the ear. And when it comes to deformity of the ear, I don't find that there's any deformity in my ear. My ear has the same shape, but I can tell that one is more flimsier or more softer than the other. So I think that's the only difference that I noticed. But nevertheless, didn't have that much of a difference that I noticed. And hardest part as well, I guess, because I'm a right side sleeper. And what helped me so much is a neck pillow, and that U-shaped neck pillow and the hollow spot in it, it's the side where I sleep so I don't get to bump my ear at that time. And by the way, I know I'm gonna get this question. It's because I was a flight attendant back then. And is it allowed to get nose job? It's not in your contract that you're not allowed. But I guess when you don't consider this whole process of the safety, aesthetic, and you ended up getting a nose botch job or with severe deformity, then you might get questioned and that can cost you for your job to get grounded. And I used to work for Qatar Airways and they're pretty strict with grooming. And I mean it, like even weight. Recovery tips. So recovery tips, I already tackled a neck pillow, especially for those of you who are a right side sleeper. And in my situation, they had to harvest the cartilage from here to support the tip. So I didn't have to do rib or whatever. Gauze, swabs, hydrogen peroxide. And I think what really helped me the most is the supplement arnica and bromelain. And prior to that, I think a week and a month before my surgery, I was drinking a lot of pineapple juice, like raw pineapple juice, by the way, not the ones that you buy in a can. And I'm not sure how much sugar is in it, but I was drinking a lot of it. I was eating a lot of pineapple, and I was also supplementing myself with arnica, which really do help with reducing the swelling. And I think bromelain, there's a lot of researches and studies that supports that. And I think they had a little bit of a difficulty at the beginning to open my mouth fully wide. So a straw, an angled straw, really helped me to sip any liquid. And when it comes to toothbrush, I don't think I bought an electric toothbrush. I was just using a regular toothbrush, but I wasn't really opening my mouth wide open. But I think in which you can. And also, don't forget to sanitize your house and always have a family member or friend to take care of you, because after my surgery, I was a little bit groggy, and I thank you for Belo Medical Group for sending me and my sister all the way to our home, because we were just about to take Uber at that time. And you know what? The funny story is, the day of my surgery, that was the day that I told my parents I was gonna get my surgery. I didn't tell them until the day that I'm planning to do it. So the day of my surgery, that was the time I was getting my nose job. Don't do what I'm doing, okay? Bad. Okay, I think that's about it, guys. So I hope you did learn a thing or two. Okay, you know what? Hold on. No. Regrets. Do I have any regrets? I think I don't have any regrets. All I'm gonna say for those of you guys who are gonna get your nose done is stop comparing yourself anymore, especially when you've seen the result and you've seen the harmonious balance of your face. I think you need to learn how to be happy and be okay with it. Someone's calling me, oh my gosh. For some reason, there's just a lot of random calls that I'm getting that are not stating my contacts, but I'm not gonna answer this one. It says a scam likely. Okay, so yeah. I know sometimes the pressures of social media can interfere and have a big effect on your decision-making factors, because there's just so much sometimes online, and trust me, I feel like I've been there. 7-year post-op, there's still days healthy support of people telling me I don't need it, I don't need it. And there was one time I was going out with a surgeon too, and he was in, I can't remember what country he's from, but he's from the Middle East. He was telling me, just don't do your lips, but I know, don't do your lips, but don't do anything to your face anymore. And I think I needed to get that reassurance of not getting anything done on my face at that time. And also, yes, just don't let social media cloud so much of your judgment, especially the influencers or the content creators that you follow, because you'll one day, like, it's a process for you to one day, like, appreciate like how you look in front of the camera. And it's sad because unfortunately it's kind of the world we live in. It's something like you have to deal. Oh, by the way, so yes, this is my nose from this angle and that angle. I'm looking in the screen, or here, I'm looking in the, again, so hold on. Okay, let's test a different light. So, walang daya. Yeah, so this is my nose up front, and this is my face, like full frontal facing too. Yeah, I think I'm pretty happy with the result, and I hope you did learn a thing or two. Let me know your thoughts in the comment section down below, and I'll try to answer as much as I can in the comment section down below. Don't forget to follow me on my social media accounts that I'll be linking in the description box down below and also in the screen. And so, thanks guys for watching, and subscribe. Bye.